Hello, everyone, and welcome to Rainbow Baby Week. Today, we are talking about acknowledging grief within pregnancy after loss. And I've got a very special guest today to talk about that and talk about some of the emotions and complicated feelings that families might navigate on this journey. So I'm going to be speaking to Dr. Kara Davey, who is a clinical psychologist. I'm going to pass over to you to introduce yourself. Thank you.
Thank you. Hi, lovely to see you. Thanks for inviting me on. So yes, my name's Kara. I work for Kara Clinical Psychologist in Sussex, and I specialise in supporting bereaved parents and people who have difficult fertility journeys, and also supporting people who are neurodivergent.
Thank you. And really, really important work. And I'm really happy that you've been able to join me today because I'd love to hear your perspective. I'm sure so many people would love to hear your perspective on this topic. So we've got some questions. We're going to start with why can pregnancy after loss feel emotionally complicated, even when it's deeply wanted?
So I guess the first thing to say about pregnancy after loss is it is inherently terrifying for most people. So if you think for most people who've had a difficult fertility journey or experienced, at least lost a baby or multiple babies before, they are literally putting themselves back in the position where this, awful thing happened to them before and they lost their baby. So, if you think if you'd been in a house fire, you wouldn't willingly want to walk back in a house fire again. But actually your nervous system and your body is saying, of course I want another baby. Of course, I still want to be a parent or a parent again, depending on people's circumstances. But I'm now going back into this circumstance before that was emotionally so tricky. So it is terrifying. And I think often what people don't realise who haven't experienced loss themselves is that it's not just, oh yes, this is wonderful news, you're expecting again. It comes with so many complex and difficult emotions. So yeah, there's the fear of it. For lots of people, it feels like, am I replacing the baby that I've lost previously, or does it feel like I'm moving on? There's a fear that even if you don't feel like that other people might then stop talking about your baby or babies that you've lost. So there's so many emotions that tend to go with it. And I think as a society, we often don't quite know how to respond to people or how to best, kind of understand and support people. So we end up making comments that can feel quite dismissive or minimizing or unhelpful just because of a lack of understanding.
Yeah, it's really tricky. I completely hear you when you say about people with well-intended comments, and then it's when you fall pregnant again, it's kind of brushing under the carpet what you'd been through before. And it's like, that's not what it's like for families. They don't want to forget what happened before. And I guess that's why this topic is so important. How exactly do you acknowledge that loss that you went through within your new pregnancy? It can feel so complicated. So some parents, they can feel quite guilty when talking about their baby who died when they're pregnant again. Why do you think that might be?
I think it comes back to that idea of, are we replacing our baby, or does it mean that we are somehow kind of moving on, as if it kind of minimizes their importance or kind of reduces how important that baby was to them. And as I say, I think for lots of people, and it's interesting because some people, when it comes to, if they're pregnant again, when it comes to the point of finding out gender, for some people, they hugely want a different gender. Not everybody, it's different, but for some people, they hugely want a different gender because it feels less like that we're replacing our baby, or we're kind of, it's almost like, oh, if I have, say, another boy or another girl and my loss was that gender, it's almost like it would be replacing them. So sometimes that's kind of a real strong gender preference as a result of that. But yeah, essentially the guilt is that idea of, does it somehow minimize what I've been through and how important my baby was to me? And as I say, that's either for the person themselves, they feel like that, or they feel like other people might feel that, and essentially that they're worried that their baby will be forgotten and erased by other people, and they will focus on the baby that they're going to bring into the world instead of the baby that's already been.
I've come across people who would rather go to a completely different hospital and have completely different healthcare team look after them in their pregnancy after loss, but then also people who really prefer that continuity and have the same care team. But I find the ones who want to go elsewhere, it is kind of about separating that experience. And it might have something a little bit to do with that experience being a standalone experience to what you went through before, and trying not to replace it.
Yeah, and I think sometimes that's a trauma perspective as well. So sometimes I will actually advise families, especially if they've, kind of had care that they question whether there was negligence that's been proven, or whether they were just unhappy with their care, or they didn't feel kind of listened or supported to in the way that they'd like to. Actually putting yourself back into that situation and the same staff and the same environment for people can be extremely traumatizing. So sometimes I will say to people, actually, you do have a choice. If this feels too difficult, it is okay. Like from the way our brains work, if we experience trauma, is the brain kind of wants to keep us safe. It will say, this is the same as before. It will highlight all the things that are the same because it wants to keep you safe. If it's the same as something that was scary, we should maybe be worried about that. And it sends our body into kind of fight or flight. So sometimes when people have experienced trauma, we say, look for the things that are different to remind your brain, yes, it feels similar, but you are safe now and it is different. And so sometimes that is a different hospital, a different care team. Even if it's the same hospital, maybe a different room or different staff, like actually that can be a really helpful technique for people who have been traumatized by their kind of previous experience. But yeah, equally, it can be about separating. We need this pregnancy to be different, just because of the guilt aspect of it too.
Thank you. So how can parents honour and acknowledge a baby who died while preparing to welcome another child? Have you come across anything that people have done, or is there anything that you would think about?
I think there's so many ways. I think lots of people, after they lose their baby or babies, they find ways of bringing their baby along with them. Like whether that is, we've got lots of charities who obviously provide teddy bears, where it's like your kind of memory bear. It might be that people have something symbolic. Sometimes people have a photo. Sometimes it's kind of a memory area, a memory wall. Or so the things that people do that help them with their grief and help them to kind of keep their baby part of the family and remembered and part of experiences. It's really important to continue to do those through pregnancy if that feels right for you. And I think sometimes that's one of the fears for people, and it goes back to that question around guilt, is almost like, well, if I visited the grave every day, or I listened to songs every day, or maybe I can't do that now because I'm less mobile, or because I'm going to lots of hospital appointments, and does that mean I care about them less? No, maybe that changes slightly, but you can still go when it feels right to, or if you've got other memories, you can keep those memories up. So I think there are lots of different ways, whatever brings you comfort and helps you. But equally, if it is really difficult to continue to do the things that have brought you comfort, it's okay to change them a little bit, or to adjust the frequency for the situation.
Yeah. Thank you. And lastly, how can parents navigate the fear that, so we talked a little bit about others and their expectation to move on. How can families kind of navigate that from the people around them?
Yeah, I think that's a really important one. So sometimes people will advise kind of family members to read kind of a bit more about what would help them and what would support them. I think there's something about kind of self-advocacy. Like, I think sometimes it can be incredibly hard to be a bereaved parent and to be advising other people what it is that you need, what would help you. But actually, sometimes if people don't know, it can be really helpful to say, actually, this would really support me, or this is how I feel, what I need. For so many people who are kind of in pregnancy again after loss, just the simple kind of both and is really important. So if you tell someone you're pregnant again and they go, oh, that's such amazing news, you really deserve this after your loss, and that's it, but they haven't said anything about, actually, this must be really complex, I imagine this is tough, or there's difficult emotions there, and of course we're still remembering your baby. Or so just that simple addition of, we recognize this is lovely news and it's really difficult, can be huge. So I think sometimes if people don't know that, it can be really important, can we share a little bit about what would help with other people? And that's not to put sole responsibility on you. If that's hard to do, maybe that is, at Christmas time, often people will put a note up saying, I really like my baby's name to be remembered in Christmas cards, and it kind of advises people so they generally know how to respond. So sometimes you can say it, or you can tell a friend to let other people know. But I think there are lovely pages on, Sam's website, Tommy's website, kind of lots of the charities advising people on how to best help and support. And I think, sometimes most friends and family will be really open, and colleagues be really open to helping in the best way they can if they understand how. And I think for those who don't understand, I often say to people, if you have really tried to help people understand how to best support you and they're still struggling with that, then actually something that's really helpful is to work out who are your people to be able to talk with this topic about and feel supported and feel helped, or kind of open to supporting and learning how to help you, and who maybe do you have that conversation less with because actually it's really unhelpful for you and they're not kind of willing to learn more.
Yeah. Thank you. Thank you so much. This has been really helpful. I hope that people watching this have also kind of taken from it some ideas. Maybe they're supporting someone who's going through a pregnancy after loss, and maybe they think about how they could acknowledge the baby that died as well. And there might be families who are sitting with those feelings and not sure exactly how to navigate that. So I hope that this conversation does help them as well. Thank you. Thank you very much for joining me today.
You're very welcome. Thanks for inviting me on.
Bye.